and go.
Good afternoon, everyone, and thank you for joining this HealthFlex webinar for the Greater New Jersey Conference. I do want to let you know that this is being recorded so that those who are unable to attend can view it, and so that if you had some questions later, you can check and see if it was maybe answered at this time. So we're going to go ahead and get started. My name is Bob Gerlach. I am the Health and Welfare Benefits Manager here at Wespath. Couple things. First of all, you'll notice on the right-hand side of GoToWebinar, there should be a module there, and you will see a questions section. Throughout the course of the presentation, you are all going to be muted. We did have over 120 people register for this webinar, but you can submit questions through that questions module. We will address them at the end of the webinar. If we still have time, we will also give you the ability to take yourself off of mute so you can ask questions. We do ask that any questions that are sensitive in nature be submitted through the questions, and we may reach out to you after the webinar with answers to those. And if for some reason we run out of time for questions, you will have the opportunity to ask questions in a variety of different ways, including responding to the thank you for attending webinar email that you would receive either later today or tomorrow. So with that, I will get started. I'm going to do an overview of HealthFlex first and foremost. That will cover the plan options, health accounts, deductibles, coinsurance, out-of-pocket max, and premium credit. I'll then talk about the differences between premiums and services, cover the decision support tools available to you as you choose the best plan for you for 2022, how you will go about making those elections, and then, as I said, we will finish with questions. All the HealthFlex plans, and when I say HealthFlex plans, I'm specifically talking about the combined medical pharmacy behavioral health plan. We will not spend time today going through dental or vision plans. But all the plans have the same operation. They work the same way. Each plan has a deductible that you pay all of before the plan starts paying its part, which is the coinsurance phase, where the plan pays a part and the participant pays a part. And then for each and every plan, once you hit your out-of-pocket max, the plan then pays for all covered expenses. You can use your flexible spending account, health reimbursement account, or HRA account monies to pay for your share in the deductible and coinsurance phase. And there are co-payments in some of the plans. They may apply before or after the deductible is met, but they do not count towards the deductible. And once the out-of-pocket max is reached, you don't pay anything for covered services, including any co-payments. Here's a handful of things that are included with every single plan. Access to the doctor or provider of your choice, no referral needed. Full access to the nationwide Blue Cross network, and access to all drugs on the OptumRx premium formulary. What this means is that you have the same medical coverage and same prescription drug coverage regardless of which plan you choose. And all plans come with our comprehensive and generous well-being programs and incentives. A few ways in which the plans are different. First and foremost is doctor, telemedicine, urgent care, and ER visits. I'm going to start on the right-hand side and work left here. The B1000 is the only plan that has fixed co-payments for those services. The HSA plans and HRA plans, you must meet the deductible and then you have coinsurance. Medications, a little shake up here. The B1000 and the HRA plans are exactly the same. Co-payment and coinsurance before needing to meet the deductible. For the HSA plans, you must meet the deductible first, and then the plan will pay its portion, co-payment or coinsurance. There is an exception there with the preventive drug list, and I'll talk about that in a little bit. And then the mental health outpatient counseling is different for all three types of plans. The B1000 has that fixed copay. The HRA plans have coinsurance, but you do not need to meet the deductible before the plan pays its portion. And on the HSA plans, we have not been able to convince regulators that a mental health outpatient counseling visit is preventive. So in that case, the deductible must be met first, and then the coinsurance applies. Here is a high-level look at the 6 plans available through HealthFlex. As I said, these are combined medical pharmacy behavioral health plans. You'll see the HSA plans are in green, HRA plans in blue, and the B1000, which is a traditional PPO plan, is in orange. The plan names are listed across the top, and you'll see that the number in the name represents the individual deductible for that plan. The family deductible is that number times 2. 4 of the 6 plans come with health account contributions, and I'll talk about those a little bit later. As I said, the deductible is included in the plan name. You'll see that each plan has an individual deductible that applies or a family deductible. The individual deductible in the HRA plans and B1000 plan applies to each person until the family deductible is met, if more than one person is covered. In the HSA plans, if more than one person is covered, the family deductible always applies. So there is no per person deductible in the HSA plans if more than one person is covered. This coinsurance line here shows the plan percentage on the left and the participant percentage on the right. And you can see there's some fluctuation in that depending upon what plan you choose. The out-of-pocket max, so the level you get to when the plan starts paying for everything that's covered. 5 of the 6 plans have a $5,000 per person deductible, $10,000 per family. The H3000 is a little higher, $6,000 per individual, $12,000 per family. And then just a quick highlight on the pharmacy benefits. You'll see that the B1000 and HRA plans have the exact same pharmacy benefit. If you look at the H1500 and H2000 on the far left, they also have the same benefit, though the deductible must be met first in those plans. And the H3000 has straight coinsurance, so there are no copays at all on the H3000 plan. So there's a lot of benefits, especially in the HSA plans, where you need to meet the deductible first before the plan starts paying. But there are many things, many benefits that you have before you meet the deductible in all the plans. The first is the discounted services and medications. So just by carrying insurance through HealthFlex, even if it is a service that you need to pay fully before you meet the deductible, you're paying a full discounted rate. And that's on office visits, ER visits, procedures, medications. Each covered person also has their well person or well-being checkup covered at 100% each year. And then there are preventive drugs, which I mentioned earlier on the HSA plans, where the deductible does not need to be met. And there's some rebate savings, and more on those in a moment. When we look at how you pay for your premiums each month, each plan has its own premium, but your employer or plan sponsor has given you money in many cases to offset the cost of your coverage, and we call that a premium credit. That is the fixed dollar amount that you use to shop for your plans. So when you go into the system for annual election, it's probably something you've seen in years past, no change there. You see the cost of the plans and you see your premium credit that will offset those costs. It shows as a monthly credit. You can use that premium credit for that combined medical pharmacy behavioral health plan. You can use it for dental premiums. You can use it for vision premiums. You cannot say or tell the system to take $200 from that and put it into an FSA. It is really meant and only allowed to offset premiums. And the premium credit is assigned based upon who you cover in that medical pharmacy behavioral health plan. So your tier of coverage, employee only, participant plus one, family, but it does not change based upon which plan you choose. Here's the details around those medications that are considered preventive and pay before the deductible is met. So the plan pays its portion before the deductible is met. This is a sampling of these categories. These are not, it is not an exhaustive list. It's about 8 pages of different drugs that are covered. Some of the more common drugs the prescription drugs that people take that would be on this list: antidepressants, cardiovascular drugs, GI and ulcer drugs, diabetic drugs. There is a list posted online when you log into Benefits Access to get at everything within HealthFlex. There is a link to this document there as well, so you do not necessarily have to write down this URL here. And the benefit of this, remember, is on the HSA plans. These are the cases where the plan will pay its portion before the deductible is met. The B1000 and HRA plans both have first dollar pharmacy coverage, so it does not matter if your prescription drug is on the preventive list for those plans. And then the other benefit that we have that we're introducing beginning January 1st, 2022, is giving credit for drug manufacturer rebates when you purchase the drug at the pharmacy. Now, this does apply to all plans and not just the HSA plans, but if it's a drug that is not on the preventive drug list and you're paying fully out of pocket for it, you're getting a much greater benefit by also having the rebates applied. So the way that drug manufacturer rebates work, generally speaking and historically within HealthFlex, is that on a quarterly basis, based upon the utilization of specific drugs within the plan, the manufacturer sends us a rebate as the plan. HealthFlex is the plan. And we utilize those rebates to offset future costs in the plan. So we apply it to the rates within the plan. What we are able to do beginning in 2022 is take a significant portion, and in some cases the full portion of that rebate, and apply it when you purchase your drug. So you may have a $100 drug that is then going to cost you $80. Just a generic example. And then if there are additional uh, rebate dollars available that are given back to HealthFlex at the end of the year or at the end of the quarter, we will still apply those to rates going forward. So the cost sharing is the same in that we use those dollars to offset costs in the plan. But in the case of those rebatable drugs that can be identified, we pass those savings on when you purchase the drug to alleviate some of those high drug costs that you may be familiar with. There's a lot of choice, obviously, with 6 plans, up to 3 dental plans, 3 vision plans to choose from. So we do have key resources to help you make your decision. We have the How Do I Choose My HealthFlex Plans brochure. That's a screenshot of that on the left. We have Alex, and that's the little globby guy in the middle, is one of the little Alex people that's available, and I'll talk through a few slides on Alex. And then specifically for your conference, since your default plan is changing for 2022 from the B1000 to the C2000 with HRA, we've actually put together a handout. So it has a little more detail than the How Do I Choose My Health Plans brochure, a little less detail than the plan comparisons document that you might be used to, but really gives a good side-by-side comparison of the B1000 and the C2000 with HRA. Because if you do not go online and choose a plan during annual election and you're currently in the B1000, you will automatically be moved to the C2000 with HRA. If you look where the questions section is in the GoToWebinar, it's on the right-hand side, probably at the bottom of that list there, and you open that up, there's a handout section, and you will see a PDF copy of this 2022 HealthFlex plan comparison, B1000 and C2000 with HRA, and you can actually open that and download it if you'd like to have that available to view later. I'm not going to go into the details of that plan now. if during the questions portion we want to take a look at some of the differences, I'm certainly open to that, but I want to make sure we get through the presentation and to as many questions as we can before we do a deeper dive into this document. So now I'll spend a couple slides on Alex, I think it's 3, uh, talking about the benefits of Alex and why I really hope you go out and use Alex. The first thing to be aware of is Alex doesn't know anything about you except for what you tell him. And one of the first things you're going to tell Alex is who you are, meaning what category of employment. I know employment is not necessarily the best, um, the best word to use when we're talking about clergy within the United Methodist Church. But you'll tell Alex what best describes your current working relationship, working arrangement, and Alex will use that to know what your premium credit is. And then you're going to use Alex, which you can do now through annual election, and plug in information based upon Alex's questions. And Alex is going to use its lively graphics and animation and humor to keep you engaged through this process. Uh, about 20, maybe 30 minutes to complete because we've added some modules this year. Alex is going to explain some of those more confusing benefits concepts using simpler language, certainly does a better job of explaining things than I do. And based upon what you tell Alex, he's going to give you a personalized recommendation for what plan is most likely the lowest cost plan for you and what type of contributions you should think about making to your health account to help offset your costs. So Alex crunches all those numbers using national averages for what services cost, what number of drugs you say that prescription drugs you need, number of visits to the doctor, to the ER, urgent care, and it's going to give a side-by-side comparison and say this is the lowest cost plan for you. Would you like to see why? And I always state that people should see why to make sure you didn't accidentally enter 22 instead of 2 for a number of visits because your keyboard key stuck, right? Takes just a few minutes to walk through and make sure if you're going to take action on this recommendation that it was based upon the right facts that you entered. When you are looking at what Alex recommended and you're looking at potentially taking a plan with a health savings account. So a plan where you might need to pay for some of your prescription drugs before the deductible is met because they're not on the prescription drug list or preventive drug list. I'm sorry. One of the things that we recommend looking at is the OptumRx drug pricing tool. So this tool allows you to enter the plan you're thinking about taking, and you could do this multiple times to compare one plan against the other. Put in your prescription drugs, put in your pharmacy, and it will let you know what you could expect to pay for this drug. Uh, and when you go through and select, you can say, I want to see the H1500 before I meet my deductible versus after I meet my deductible. So you can see how that drug cost is going to change, what you're going to have to pay maybe before your deductible is met versus after. And you can make a more informed choice on what is the right plan for you. It will help you figure out how much money you might need to put into a health account to offset some of those prescription drug costs. And I'll bring them up again later. The AE support team that's available to you starting next week, they also have access to this tool and can help you walk through it. You can find this tool again going through benefitsaccess.com, single signing on over to the health information. There will be a link, but it is optumrx.com/enroll/Wespath. That will take you to this page that you see. This one's actually clicked through on the drug pricing tool already, but on the prescription drug list that you could click at the top, you would also be able to get to the preventive drug list. It's all housed on this one site. Health accounts are really a key function of most of the plans in HealthFlex. 4 of the 6, as you can see here, come with some funding built into the plan. So that's funding that's available on day one to help offset those costs that you have early in the year before you meet your deductible. And then the H3000, while it does not have employer contributions, like the other HSA plans, gives you the option to make your own contributions to the plan. It's also a place where excess premium credit can be deposited, and you'll see that in a moment. And then for the HRA plans and the traditional PPO B1000 plan, if you would like to make personal contributions, you can do that through a healthcare FSA. While it is true that if you have an HSA plan and you're contributing to an HSA, you can also contribute to a healthcare FSA, that is not a very common practice. And for the vast majority of people, you would not even want to consider doing that unless you were already maxing out your HSA. But if that's something you are interested in, you can reach out to the conference or you can reach out to the health and wellness team at HealthFlex, and we have a handout that talks about the intricacies of having those two plans together. What I'm going to do now, and this is really the biggest meat of the presentation, if you will, is I'm going to walk through some scenarios, uh, individual coverage, participant plus one coverage, family coverage, and show you some of the cost of these plans and really the impact on health accounts of the premium credit in these plans. So the next two slides after this are going to look very similar to this with some number changes. But for all of them, you're going to see the plans listed on the left in alphabetical order. You're going to see the actual monthly premium of the plan. I'm showing the monthly premium credit for active clergy here. And of course, the premium and premium credit will change as we go through. You'll see that on 2 of the 6 plans here, the premium credit exceeds the amount of the premium, which means that if you take exam core vision and no dental coverage, which I'm going to assume for all of these because it's easier to do the math without so many permutations, that 2 of the plans will have excess money go into the health accounts each month. So the C3000 with HRA is going to have an extra $96 over the course of the year go in there, right? $8 a month for 12 months. And the H3000 with HSA is going to have over $1,000 go in over the course of a year. So what you end up with is in individual coverage, 5 of the 6 plans end up with money in a health account. 4 of them have money built in. The C3000 gets that bumped up a little bit, and the H3000 that does not have money built in ends up getting the $1,080 put into the HSA over the course of the year. When we move to participant plus one coverage, the plan order stays the same. The monthly premium goes up, the monthly premium credit goes up, and the excess premium credit deposited to health account also goes up in those 2 plans. Goes up a little bit in the C3000 with HRA and goes up pretty significantly in the H3000 with HSA. So we have the same net result here of now 5 plans have money in the health account, 5 of the 6. And if you look now, all of a sudden, the H3000 in participant plus one coverage has the most money built into the HSA with that excess premium credit going in. And then finally, family coverage, premium credit increases again. Premium, of course, increases again. The amount going into the C3000 and the H3000 goes up, though not as significantly as we saw the jump from participant to participant only to participant plus one. And we again are left with 5 plans having health account balance available to you to offset costs. So really, when we look at the health accounts in the other plans, there's a huge benefit within those health accounts of money to spend on services. You might be asking yourself, though, how much do services cost? I've been in the B1000 for a lot of years. There's copays, and I like knowing that if I go to the doctor, I have a fixed copay for this service. I don't know what it's going to cost if I choose one of the other plans and have to meet my deductible. Well, an office visit in the B1000 is $30. And if you go to one of the other plans, and you get the benefit of that fully discounted cost. So once you meet your deductible, this is what the plan would pay for it, but the plan's not paying. You're paying. You're still getting the reduced cost negotiated by Blue Cross Blue Shield. So you're paying on average $78 to $100 for that visit. If you're going to urgent care, the B1000 has a fixed copay of $100. And in the other plans, the average is probably between $150 and $200. Now you might be saying, well, that's average, but I live in an expensive area. I'm in New Jersey, I'm in New York. Our services might cost a little more, and that is potentially true. I can share, though, two very specific examples from just 1 month ago where my wife and I went to urgent care. We are in the H3000 plan, so we pay the full discounted cost up until the deductible. And we are in a suburb of Chicago, so again, not an inexpensive market. My wife ended up going to urgent care with a cough, and she had bronchitis. And I ended up going with a cough, and I had strep throat. So we went 2 days apart. She went, I think it was September 14th, and I went September 16th. The cost for her for this urgent care visit, where she was diagnosed with bronchitis, was $188 and change. And I went for strep, so the test they did on me was a little bit different. Mine was less expensive. Mine was $136 and change. So pretty much right there within that average, and a fairly recent example to share. So I feel pretty comfortable with these numbers as reasonable averages. And then generic prescription drugs, the B1000 and HRA, we have that copay on those drugs, $10 for 30-day, $25 for 90. This is, of course, assuming that the cost of the drug is more than what's listed here. And I have an example to share on that as well. The H1500 and H2000 will have those same copays after the deductible is met, or immediately if it's on the preventive drug list. And then the H3000, once you meet the deductible, you would pay a straight 60%. So for my example here, again, I think I mentioned myself, my wife, and my daughter are in the H3000 plan. My daughter last year had an ear infection, swimmer's ear, so we had to meet the full deductible. So we had to pay all discounted costs before the deductible is met. So we went to her primary care physician and paid $78. She was diagnosed with an ear infection. He prescribed an antibiotic and some eardrops. The antibiotic was $2.71, so we paid the full cost of that. That was no big deal. Her eardrops were significantly more expensive than that. They were just under $200. But with the antibiotic and the eardrops, it was less than $200 for both. And then her visit was $78. So we paid under $300 for that visit. But when you look at the savings in premiums, so remember, you pay your premium each month whether you use the insurance or not. And that's why if you're a low utilizer for sure, or if you're someone who has a good understanding of what you're going to pay each year, we feel that you might find a lower cost alternative in a plan that is not the B1000, because you're only paying for services in the other plans when you use them versus the high premium you pay in the B1000. So when we look at the premium differential, in the B1000, you will pay anywhere from $33 a month to $219 a month more than other plans if you're only covering yourself. That jumps to a range of $64 to $416 a month if you're covering yourself and one other person, and then $87 a month all the way to $569 a month if you have family coverage, so if it's 3 or more people in your plan. And what you get when you pay those premiums is a savings of anywhere from $48 to $70 per visit on an office visit to your doctor. For urgent care, you're saving $50 to $100. So you can see that if you are a low utilizer of these services, there's significant savings that could be had by diverting your premiums to instead saving that money and spending it on services. And you can do that in a variety of ways. You can put it in a health account, you could just put it in the bank. Hide it under your mattress if you're more comfortable doing that. But this way, you're only spending on services when you have them. Now, that is not to say that there are not people who should be and who would have the lowest cost experience in the B1000. We know that that exists. We wouldn't offer the plan otherwise. But the vast majority of people who are in the B1000 is because they are comfortable with those copays. And that is perfectly fine. If you would like to take the B1000 plan, go in through annual election and select that plan. I would encourage you to use Alex and see if you might be overspending by being in that plan. HealthFlex is, of course, part of Wespath. It is not for profit. I do not want anyone to be paying more for insurance than they need to pay. And when we look at a 3-year average of what services cost, and we've looked at de-identified data of all participants in HealthFlex, we've found that less than 1% of people had the greatest savings, the lowest cost plan experience by being in the B1000. So while it is possible, it is rare. So please go out and look and see what the best plan is for you. And then, as we saw with all the plans, 5 of the plans, either because of money built into the plan or premium credit savings, give you contributions to a health account to help pay for those services. You do not get those in the B1000. So in addition to those premiums, every time you go and utilize a service, you're going to pay something out of pocket. Now, maybe it's money that you've put into an FSA, but if you haven't and gotten the tax benefit there, you are paying with non-tax exempt dollars for those services. And as I said, Alex is the best place to estimate your specific utilization and choose the plan that you are most comfortable in. You will go to benefitsaccess.org for the most part to make your elections. There are some people who cannot access benefitsaccess.org. If you've tried to do so already to view your pension information, you may know this. If you're able to get in there for pension, though, you're able to get in there for health. If you can't get into Benefits Access, you would go to benefitsolver.com and create a login. That is where Benefits Access takes you. So it's just kind of not taking advantage of the single sign-on we have built into Benefits Access. If you do need to go to benefitsolver.com to get in and make your elections, I would suggest reaching out to the Wespath Health and Wellness team. So that's just calling the normal Wespath 800 number, pressing 2 and 0 when you're prompted, and you will get a representative who can walk you through this process. Annual election will be November 3rd, which is 2 weeks from today, through November 18th. Please use Alex to determine what plan you want, and then go to Benefits Access or Benefit Solver to make your elections. While Alex will walk through and help you choose the plan, Alex does not enroll you in any plans. If you do not make elections during annual election and you are currently in the B1000, your medical pharmacy behavioral health plan, the B1000, will automatically be moved and you will be in the C2000 with HRA. Your dental and vision plans will remain as they are today, and all the people you have covered in the various plans will remain covered. If you do not log in to make your elections for 2022, you also will not have FSA or HSA personal contributions. Starting next week, if you need any additional help, if you have other questions, in addition to calling the health and wellness team, we have leveraged Benefit Solver's AE Support Center that are trained on our specific plans. It is more people than we have at Wespath, so the wait times should be lower in this high volume time. They can answer basic information or give you basic information, answer questions about the plans, about health account information. They can help you, as I said earlier, with that drug pricing tool. And they're available 7 to 7 Central Time, Monday through Friday. So that gives you on the East Coast an extra hour to contact someone that you wouldn't have with the Wespath call center. So that's another added benefit for you. With that, I am going to now open it up for any questions that have been asked through the questions module. If we have time, once those have been answered, we will open it up for people to ask questions verbally. Feel free to continue typing into the questions module. I certainly do not want you to forget your question as we go through and address any that have been asked already.
Thank you very much, Bob. We did receive some questions and I was able to
Okay.
answer some of these, but we did have some that went around retired. So do these plans
Okay.
that you talked about currently apply to retired clergy?
So these plans would apply to any pre-65 retired clergy or any spouses under 65 of retired clergy who may be off the plan. If you are retired and over 65 and in some type of Medicare supplement or companion plan, then these would not apply to you.
And to follow up on that, when might they receive information regarding the retired clergy plans?
So I do not know if we have any representatives from the conference on the phone who could
Alexis
address
is
that.
on
I
the
think
phone.
Alexa is on.
Mhm.
Yep.
Hi, Bob. This is Alexa. Can
Hi,
you hear
Alexa.
me?
I
Hi.
can, yes.
Um, so all of our information regarding the plans have been posted on the website. And when we send out the email, we directed everyone to our website to locate the details on the plans.
Okay, and then was that for retirees as well?
That's correct.
Okay. So then if someone did not get that email, should they contact the conference office?
Yes, they may do that.
Or they can go out to the website and look, right? I mean,
Yes,
the
it's on
information
our
is there.
yes, the information is on our G&J website, and the retirees that are over 65 actually have webinars coming up. All those details are on the website.
Great, thank you.
We did have a question regarding what is the insurer, and is that Blue Cross Blue Shield, and is there a difference between which one it is?
So, good question. So, nothing is changing there if you're covered today, but on the medical and behavioral health side, so those are together. It is Blue Cross Blue Shield of Illinois. That is where Wespath is located, so that's why we contract through Blue Cross Blue Shield of Illinois. But we use their full nationwide network, which means it would use the local Blue Cross network. So, if your doctor is in the local Blue Cross network, they are in this plan.
For the clergy contribution, what line and code is to be used on the W-2 form?
So that's a good question. So for the clergy contribution, the only contribution that would appear on a W-2 form that I am aware of is a personal HSA contribution, and the local church puts that on. I do not know if on the W-2 the premium credit is installed on there. If it is, it would be the salary paying unit who would need to put that on there. I do not expect a participant to have to enter any W-2 information other than when they file their taxes, taking the number off the W-2. So if
Okay.
you are someone who is completing these for your local church or other entity, I would suggest you reach out to Wespath directly, and we have some materials that we can share on how W-2s are to be completed regarding benefits offered through Wespath.
Another question we have is how much can be put into FSA or HSA?
Of course, someone's going to put me on the spot with numbers that I did not include. So I do have those. So for an individual who is covered in an HSA, who is under 55, if you were covering yourself, you could put in 3650 a year. If you are covering more than one person, you can put in $7,300 a year. And if you are over 50, you can add $1,000 to that amount. For the FSA limit, I am actually expecting an announcement soon for the limit going up next year. But the FSA limit right now is the same as 2021 until we get final confirmation, and it is $2,750. I have seen numerous reports stating that it is expected to go up by $100 for 2022, but that has not been finalized yet. If it is finalized in time, the IRS does this to us every year, is they announce it either right before annual election opens for us or right after it opens, which gives us very limited or sometimes zero time to make the system change to accommodate. However, as long as they make that change in November, the early part of November, we will reach out to anyone who has contributed. We will probably ask for the conference's partnership, anyone who's contributed the max already to see if they want to contribute the new max. So we will make every effort to allow individuals to take full advantage of the new limit when it's announced. But as of right now, it's $2,750 for 2022.
Another question we've received is, would we use the WageWorks card for HRA? Is the Health Equity card used for HSA? What card is used for the B1000?
All excellent questions. So I'll just do an overview of the health account card. So yes, there are people who still probably have the orange with a little bit of blue WageWorks card. If you have that card right now and it has not expired, that would be linked to the HRA and or the FSA. It will always pay the FSA first and the HRA second. If you have an HSA, that is a purple health equity card, and that is only used for the HSA. And if you do not have the orange WageWorks card anymore, or you may have already received the teal health equity card, or if you sign up for an HRA or an FSA going forward and don't have a card, you will get the teal health equity card, and that will work the same as the orange and blue WageWorks card in that the HRA and or FSA will both be linked to that card, and it will always pay FSA first, HRA second.
All right, that was a great overview. So as a follow-up to the question earlier about the W-2 form, can you provide the link for the Wespath information on how a church can put insurance contributions on the W-2 form?
Yeah, I do not have that at my fingertips, but we will reach back out afterwards and share that document, or we will partner with the conference to get that to you. I do not have access to that right now. I'm sorry, I was not expecting that. Maybe I should have, but we will get you a copy of that document.
All right, another question is, if a retired clergy's spouse is still working and will be retired as of January 1st of 2022 at the age of 62, what health insurance plan would she be under?
Okay, so right now, I'm based on the question, I'm assuming covered under the participant and in HealthFlex today. Alexa, what are the conference's rules for a pre-65 retiree of the
So the participant, if the participant is retired and the spouse is still working and under 65, that spouse cannot go on to the United Healthcare plan anyway, because they need to obtain Medicare A and B. So the spouse will remain on the active plan until the spouse turns 65 and obtain both parts of Medicare.
Okay. So thank you. That means that they would remain on this coverage until they are Medicare eligible.
Correct.
Thank you.
Okay, probably another follow-up to that. Will a spouse of a retired clergy need to start contributing for his or her health insurance?
If the clergy person has 100% conference paid benefits, the spouse would not need to contribute, but as Bob said, would be shifted into the C2000 plan.
Thank you. Are there any limitations to switch from HSA back to an HRA since I already have money on the WageWorks card?
So you can change your plan each and every year. Um, if you are going from an HSA to another plan, uh, actually, or to no plan, once the money is in the HSA, those dollars are yours to use for any services you want. You can only contribute to the HSA while you're enrolled in an IRS qualified high deductible health plan, but the dollars you can always use. If you are currently in a plan with an HRA or you have an FSA and move to an HSA plan, if you're eligible to contribute to the HSA, you cannot use HRA or FSA dollars for medical, pharmacy, or behavioral health, at least not at the start. There's what's known as an IRS defined deductible that must be met before you can use those dollars for medical, pharmacy, and behavioral health. Before that happens, you can only use them for dental or vision. We do have a handout that talks about these considerations that is most likely available on the conference website. If not, we can get it to you, and it is available once you log into Benefits Access and go to your health benefits. But in regards to switching plans, you can switch plans every year. For most people, once they've enrolled in an HSA plan, they tend to stay in that plan because there's more flexibility with contributions and more savings there. Um, but you're not required to. I think that's just the most common occurrence. And certainly, insurance needs can change from year to year, which is why we encourage everyone to go out and use Alex and make sure that regardless of what plan you're in today, that you pick the right plan for next year.
Another question is, what if Medicare age drops below 65? Will retired clergy spouses need to go on the retirement insurance program?
So is that question if Medicare changes their rules on retirement? Um, I think if that ever happened, we would probably have some very large discussions across all of HealthFlex. Uh, I don't I don't foresee that as something that's likely to happen as the Social Security age for retirement keeps moving the other direction. Uh, but certainly, if something happened and the normal retirement age set by CMS changes, then yes, we would address that. And just note that the Medicare retirement age is not impacted at all based upon the United Methodist Church's mandatory retirement age 20-year rule or anything else that is currently in the Book of Discipline.
What is the difference between FSA and HRA?
FSA and HRA. So the FSA or flexible spending account is an account that is made up by participants' pre-tax contributions to be used to offset health expenses in a given year. Generally speaking, the FSA is only good while you are employed and expires at the end of a year. There's some COVID provisions now that allow a little more than usual to be carried over to the next year. I believe it's at $550, but it only carries over if you are employed and select a plan through HealthFlex. The HRA or health reimbursement account, sometimes called health reimbursement arrangement, is only employer money. So an individual could not make their own contributions to that. So it's going to be made up of money built into the plan or excess premium credit. Once money is in that plan, it is yours until you terminate an effective relationship with the UMC, which means you can carry it into retirement and use it for healthcare costs. It does roll over from year to year as long as you're in a plan or retired. As I said, if you terminate, you could lose access to that account. We give you 3 months to spend it down. And I think that covers the HRA roles.
Yep, I think that sounds great. Another question, I received the Teal Health Equity card in the mail. Should I do anything with this at this time?
At this time, if you receive the card, it should be because you have HRA or FSA dollars available, so you can use that to, pay for prescriptions at the pharmacy, pay at the doctor's office, the hospital for a service. Um, you can, if you have already paid for something out of pocket and you have the receipt, you can go online and get reimbursed from that account. But it should mean that you have a balance available to use to help offset costs. If you have specific questions about it, like what plan you're in and how much might be there, uh, you can certainly go online through Benefits Access and you will see the amount of money that's on that account or in that account. And if you have questions beyond that, you can reach out to the health and wellness team at Wespath and they'd be able to assist you.
Can you clarify on how much the participant will be paying per month per the plans? Is there a document with that information? So I believe that was in the presentation on the slides.
Yeah, I had some slides in here for that. So um, when you look at individual coverage, and I'm not sure if the conference has posted any information on this. You will be able to see it when you walk through annual election. That is honestly the best place to see it because as you select different dental or vision plans, what you would pay adjusts. So it's the best place to see it all together. Um, but if we look here, there's only one plan that on a monthly basis, if we just look at medical, and when I say medical, I mean medical pharmacy behavioral health that you would pay for, and that's the B1, or I'm sorry, two plans, the B1000 and the C2000 with HRA. So you're either paying $129 a month or $96 a month, if I did my math right, um, for the B1000 or C2000 if it's individual coverage. If we go over to, did I miss one? Sorry, or the H1500, you would pay $75 a month. H2000, you'd pay $1 a month for that coverage. If you go over to participant plus one coverage, and I'm doing this math in my head on the fly, so I apologize if I misspeak. It looks like $247 a month for the B1000. Now it's getting trickier for me. $173 a month for the C2000. Looks like $145 for the H1500 and $6 for the H2000. And if we go to family coverage, and of course these numbers are getting even more difficult for me, so I apologize. $337 a month for the B1000, $150 even for the C2000, $196 for the H1500, and $5 for the H2000.
Bob, the conference has also posted the cost calculator that we received from Wespath, which reflects
Okay,
all the plan variations. So participants can go onto our website under the health insurance section, and they will find that cost calculator, and they will see a snapshot of the costs with the variations, including the vision and dental plans.
perfect. Yeah, so that cost comparison, so everyone knows, shows. I think it's laid out by tier and then by different plan combinations, right? So it shows the cost for each medical plan, and then shows if you choose dental and which vision. There's a different sheet that will show you all the different costs.
Another question is regarding the plan that will be automatically chosen if they do not actively enroll? Could you explain what that will be?
Sure. I'm actually going to, Cheryl, I'm just going to switch what I'm sharing here for a minute because I think that will help. So I will share my screen back in a minute, everyone. I apologize for the blank screen, but this will be much more beneficial if I pull up what we're talking about here. So this is the handout that I said we had in the handout section. So let's go through for just a couple minutes some of the differences between the B1000 and the C2000 with HRA. And this is just, I'm going to do some high level things here. So the first thing that you're going to notice is that the annual deductible is double in the C2000 with HRA compared to the B1000. However, it also comes with money built into that HRA that you can use to offset your costs in the deductible phase. And you'll see that they are half of what the deductible is. So it effectively reduces the deductible in the C2000 with HRA to be equal to the B1000, right? Because if you have to meet your deductible, at least for me, I don't usually keep money sitting around, that I would keep separate from my health account. So in the B1000, if I'm covering myself, I'm going to have a $1,000 deductible. In the C2000, I'm going to have a $2,000 deductible, but I'm going to have $1,000 to pay towards that deductible. So when you do the math, it makes them equal. They have the same out-of-pocket maximum. So the amount you would pay in a given year is capped on services at the same level of the B1000. The coinsurance is the same, right? 80%. So once you hit the coinsurance phase, the plan is paying the same. It's going to cost you the same. You may recall that I talked about the differences between some of these co-payments in the B1000 versus what happens in the C2000 specifically. So you have a $30 co-payment in the B1000. You pay 80% up to you pay the deductible or the full amount up to the deductible, which could save you $70 to $100, right? Just based upon the example I used. But you have the money in the health account to help you meet that deductible. Then the additional co-payments, behavioral health office visits, outpatient therapies, specialists. So those are the only areas where the benefit is even different. It's just the co-pays versus meeting the deductible. So it's really only those visits that you have to worry about paying something different in the C2000 than you would have paid in the B1000. We can go and look, outpatient services. Both plans meet the deductible and then pay 80%. Here's the ER visits and urgent care, physician office visits where you have a co-payment in the B1000, but co-insurance in the C2000 with HRA. So and then you get to the pharmacy benefits here at the end, it is the exact same benefit. So we're really only talking about the differences here of those primary care visits, ER visits, urgent care visits, and just to jump back to that quickly, here's the differences in those, right? So overall, the plans are very, very similar. You're obviously paying a little bit less also to be in the C2000 with HRA than you would in the B1000, and you get that health account balance to help pay for those services. So they are close to equal plans, even when you look at what you're paying out of pocket for certain services.
So to reiterate, the C2000 is going to be the default plan, correct?
It is.
And the B1000 is not going away.
The B1000 is not going away. That's an excellent point, Cheryl. So what we have found is that a number of people take the default plan without even thinking about it. We've done a number of studies to see that happen. And since we know that most people who are in the B1000 could save money in another plan, we feel as though the right thing to do is to keep the B1000 available for those who want to select it, but not make it the default plan. Having the most expensive plan being the default plan leads people to believe that that is the best plan. When there is no best plan, there's only the best plan for you. So we want you to go out and make those changes. The reason the C2000 with HRA is the new default plan for Greater New Jersey is, again, not that the Greater New Jersey Conference is saying this is the best plan for everyone. What it's saying is we know people are comfortable with the B1000. We don't think it's, and these are my words, not the conference's words, but necessarily appropriate to keep the most expensive plan as the default plan. So we're going to change the default plan to the plan that is most like the B1000 to limit disruption for people if they forget to make an election, right? If they forget to go in and choose a plan. But if everyone who's in the B1000 right now wants to go in and elect the B1000, you can have it. Um, you know, I think that most of the people in that plan are probably overpaying for insurance, which is why I want you to use Alex and go out there and figure out what the right plan for you is.
So there are some other questions, but we are at time. So Bob, Alexa, do you want to continue?
I will leave it up to you, Alexa. We can either answer the questions that have come in or we can respond to them offline. I am happy to do either.
Okay. If you don't mind, if we can stay on a little longer and just answer a few more questions, that will be fine.
Okay.
All right. My spouse is going to be 66 and is covered under my health plan. I'm 63. Does this limit which plan I can use?
It does not limit which plan you can use. This is probably a little more in-depth than what we have time for. I would suggest that we have a conversation offline about this, or we respond offline with some with the materials regarding, you know, HSA and Medicare eligibility. So if you have
And
not
Bob,
put
they
your
can
contact
reach out to
information in,
me. Yes.
I'm
And
sorry.
they can reach out to me at the conference office, Bob, and
Okay,
speak with me in detail about that question.
that would be great. That would be great. And then if you need support, just let me know.
Yes, thank you.
If an
Okay.
active clergy is able to be on their spouse's insurance plan, will the churches still need to pay the $18,000 for the year?
So currently our health insurance guidelines state that anyone who waives out of the plan, the church is still responsible for the cost of the blended rate. So that policy is still in effect.
And that is fairly common across the denomination.
Another one is if I'm already in a plan since 2021, do I still have to do anything for 2022, or it automatically renews my current plan? I think we talked about that about the default plan now is going to be the C2000.
Right. Yeah. If you're in the B1000, you're going to get moved. And if you have personal FSA or HSA contributions, they will stop next year unless you go in and make elections. But other than that, yes, everything you have today will continue
Okay.
for next year.
Yep. Also, are the HSA and FSA the only plans that require a W-2?
So I think any W-2 conversations we're going to have to take offline and direct to the conference. You know, contributions to an FSA and HSA are reported on the W-2, and you need to file those when you file your taxes. But there is not any additional form requirement based upon what plan is chosen.
And I think you can probably answer this fairly quickly. What's the difference between copay, deductible, and coinsurance? I know it's a common question
Sure.
to add, but
Yep. So deductible is the amount of is the dollar amount that the participant must pay out of pocket before the plan pays anything. Uh, a copay is a fixed amount that the participant pays, with the plan paying the rest, and in certain cases, the co-pays do apply before the deductible is met. Coinsurance applies after that deductible is met, with the plan paying a fixed percentage and the participant paying the remaining percentage for all services. And then just to round it out, once the out-of-pocket max is reached, that is the maximum that an individual or a family pays in a given year for covered services.
Perfect. One other question we have is if you can remind me what the difference between the HSA and HRA is.
Sure. HSA is a health savings account, which is money that can be saved and contributed and saved and used for healthcare expenses. It must be paired with an IRS qualified high deductible health plan, which all of our green H plans are. And there's and it can have participant money go in or plan money go in, employer money. An HRA or health reimbursement account is an account that also can be used to pay for healthcare services, but the only money that can go into that account is plan money or employer money. Personal money cannot be deposited into an HRA.
As of right now, I think this takes care of all the ones that came through the questions pane.
Okay. Well, we've gone over by about 6 minutes, so I thank anyone who stayed with, and I'm glad we got to those questions. As I said earlier, if you have additional questions, there are plenty of opportunities. W-2 type questions or retiree type questions. I think we're going to filter through the conference office right now as primary, but if we need to address those, we certainly can as well. Feel free to respond to the follow-up email coming out of this webinar, thanking you for attending. If you have other questions, you can also contact the Health and Wellness team at Wespath, and we will get those questions routed appropriately. Thank you all for attending. There is another session tomorrow evening that we are putting together. And, as I said numerous times during the presentation, please go out and use Alex. Please make an active election. Even if you end up choosing the C2000 with the same other coverages that you have today, please make an active election so you can see exactly what it is that you are choosing. Thanks again, everyone. A recording should be available by the end of the week.